stop to think about your city, not just as the place you live, but as this active force that's actually shaping your health every single day? I mean, from the air you're breathing right now to the streets you walk down, your environment is playing this huge, often invisible role in your well-being.
Okay, let's just dive right in with a fact that is, well, it's pretty startling. In South London, there's a 12-year gap in healthy life expectancy for men living in neighborhoods that are right next to each other. We're talking more than a decade of good health that's either gained or lost just based on which street you live on. And that right there raises this massive question. How is that even possible? How can your zip code end up being a better predictor of your health than your own genetic code? How can our immediate surroundings have that big of an impact on our lives? Well, to start untangling this puzzle, we've got to look at a field called urban health. It's a whole area of study that's dedicated to understanding this exact paradox, how our cities can be home to some of the healthiest people on the planet and at the same time, some of the unhealthiest. You see, urban health looks way beyond just hospitals and clinics. It's what you call an interdisciplinary field, which is a fancy way of saying it pulls in experts from everywhere. They look at everything from housing and transportation to social connections and air quality, all to get the full picture of what makes a city and the people in it either healthy or sick. And this really gets to the two-sided coin of city life. On one hand, you've got the urban advantage, amazing access to top-notch medical care and all sorts of services. But on the flip side, cities can hit you with an urban penalty, things like pollution, stress, and just huge inequalities. So let's break this down a little more. Researchers have actually pinpointed specific kinds of health challenges that really get concentrated in cities, and they've organized them into a pretty clear framework. They call it the triple threat. So first, you've got infectious diseases. When you have a lot of people packed together, it just makes sense that germs can spread faster. Second, there are the chronic, non-communicable diseases. Think heart disease, diabetes. These are often driven by urban lifestyles and the environment. And third, cities, unfortunately, tend to have higher rates of injuries from things like traffic accidents and violence. Now, here's the crucial part. These threats aren't just random. They are deeply, deeply connected to the world we've literally built around ourselves, the very fabric of the city itself. And when we say physical environment, we're talking about everything. The quality of our homes and roads, the air we breathe, the noise we hear all day. It's about whether you have a park nearby to take a walk, or if your neighborhood turns into a dangerously hot heat island during a heat wave. But you can't really separate the physical city from the social city. Things like income inequality, feeling isolated, or not having access to resources, these are the factors that decide who gets to enjoy the city's advantages and who ends up suffering from its penalties. And just when you think you've got a handle on how complex this all is, a new, massive force is entering the game, and it's making all of these existing problems much, much worse. And that force is climate change. Climate change acts as what experts call a threat multiplier. It's a great term. It doesn't just create totally new problems. What it does is take the vulnerabilities our cities already have, like strained infrastructure or at-risk populations, and it just cranks up the volume on them, increasing the risk of everything from heat stroke to disease outbreaks. Okay, after looking at all those challenges, I know it's easy to feel a little down, but here's the really optimistic part. We actually have a blueprint for engineering a healthier future. The solutions are right there, they're within our grasp. And the solutions aren't just about building more hospitals. They're what experts call low-regret strategies. These are things like making sure everyone has clean water, creating more parks and green spaces, building communities where you can actually walk. They're just no-brainer changes that improve our daily lives and make us more resilient, no matter what happens. And hey, this isn't some fantasy wish list. Cities all over the world, from Calgary to Brisbane, are already putting these kinds of ideas into action. They're actively working to build healthier, tougher urban centers. And this quote, it just nails it. Creating a healthy city is about so much more than healthcare. It means we need a collective effort. We need urban planners, employers, community leaders, and regular residents, all of us working together to shape the physical and social world we all share. So that leaves us with one final and I think really important question. We know our cities are shaping our health every single day. The real question is, how will we, as the people who live in them, help shape the future of our cities for the better?
That's a wrap on today's explainer. If you're loving the content, show us some love with a like and subscribe for more urban planning goodness. Got a question or topic you'd like us to cover? Leave it in the comments. See you in the next video.